So today I am demonstrating our regional block trainer, and this trainer is for target practice. So whenever we teach novices, we must have a fictional contract, the contract between the instructor and the candidate, because sometime you don't see things which you routinely see in human beings. So you assume things, and if you both assume, then it will be easy to learn. So this is a work trainer. So we have marked this, like this is like a patient is lying supine, and this is the cephalad portion, this is the caudal, this is the lateral part of the body, and this is the medial part. So now what we are going to do is to do target practice. Like first of all, how to calculate the angle of the skin with the needle and your needle trajectory. So now let me scan from lateral to medial. Like we are keeping the probe in the just in inguinal ligament, over the ligament, and this is what I see. So this is basically a psoas tendon, and this is a pang block. So now how to calculate the that's the artery. Okay, so that's the femoral artery, and this is the tendon. Okay, so now if we freeze this, so now basically we now this is 90 degree. Okay, now the needle trajectory is from here to here. We have to come here, so that we deposit the local anesthetics below the psoas tendon. So if this is 90 degree, so then I think this, like I have to come from here, so it will be approximately 45 degree. So that's what I'm going to do. Now I'll show you how to do it. So how to calculate the angle. Okay, so this is my, so you see this is the angle, like now this is 90 degree, right, and this is approximately 45 degree, and that's my needle. So like this is the angle I have to go, and slowly my needle trajectory I'm targeting the psoas tendon. So you must visualize the tip all the time. So that's my tip. Okay, so the, yeah, now I'm touching the ischial spine, inferior ischial spine. So this is the purpose of this trainer for novices. Like they don't hesitate, so they have some experience, hands-on experience, because most of the time it is the sonoanatomy which is taught, but with our simulator you can do needling. So you can see now if I retract, and if I have to suppose if I have to go over the psoas tendon, then my angle become shallow, like approximately say 35 or 30 degree. So this is the thing you can practice in our target trainer simulator. Now going to the second. Now see, these are the vessel, two vessels, and lower down is the nerve. So we have to target this. Okay, this is, we have designed femoral nerve, and again this is the 90 degree, and you have to come approximately 45 degree, 35 to 45 degree, maybe 60 degree. That you will learn with practice. So again I'll show you how I am going to target. Again the angle. Okay, it will be slightly, so now see my angle is shallow, so I am advancing toward the vessel, but I need to be a little bit steeper, right? So maybe like 45 degree. So now I am approaching the nerve. So this is my angle. So this is approximately 45 to 50 degree. So this is how, and you must visualize the tip all the time. So this is how you can target practice on our simulator. Okay, coming to the third one. So this is the third target practice. Now you can see what we have designed here. Like this is the cephalus block basically. So this is the sartorius. So you have to come from here. Now you see the angle is quite shallow, maybe 30 degree. Okay. So now the needle. Just see, bring the focus into the focus, the artery. Yes. Now here, this side, angle. See my angle? It is shallow. This is the angle. Okay, that's my needle. So that's what you need to practice. So move the probe or the needle, not both the things. Okay, then I'm piercing the this sartorius muscle and going down. So whenever you in doubt, please retract the needle and go again. So let's see where's the tip. So do this again. So this is the tip. Can you see? This is the tip. So here we need to deposit the local anesthetics. Okay. So after piercing, like if you see my needle, it is going. Now sartorius, it is impinging upon the sartorius or fascia, and now it is going down. So this is what you can practice. So this was quite shallow. Okay. So you can have target practice on our simulator and before you do on a real patient. So we basically have designed for novices. Now I'll show you erector spinal plane block. We have learned how to calculate angle, how to calculate our needle trajectory, and then how can we perform the erector spinal plane block. So this is our ESPB trainer. So again, cephalad and the caudal, lateral and medial. Okay, so we have to go, as we know, from lateral to medial and scanning from the rib. So these are the ribs. Okay, you see semicircular rib and little bit more medial, and then you see the transverse processes. So these are the transverse processes, and then further medial, these are the spinous processes, right? So now we have to go at the tip of our transverse process or TP. So again, like if I ask you like to calculate the angle, so I have to come here, and this is 90 degree. So for me, it is approximately 45 degree. That's what I am going to do, and let's see where we reach. Okay, now, so that is the needle approaching and hitting. So you can feel the bony structure when you touch the tip of the transverse process, and here you need to lift the fascia of the erector spinae muscle. So these are our trainer for novices who can master these technique, regional block, which are very important modality for relieving pain in acute trauma. And I'm thankful to organizer who are asking for this trainer, because we are basically trying to improve trauma care in India. So here you can have multiple puncture. Okay, and again, so now show here. So put a little bit of gel. So now again, like these, like this is lateral. So I'm lateral, I'm moving towards medial side. So you can see the ribs and like little bit medial, transverse process, and then spine process. Okay, so medial to lateral, lateral to medial, you can practice. Okay, so one more trainer we have given. This is for again for needling. So again cephalad, and this is the patient is lying this cephalad, lateral, medial. Again we will put the marker for the probe where you have to put the probe. So this is the vessel. Now, like for practice, like you can ask the candidate to come here, you can ask the candidate to come here also, down there. So like you can put the target over here for longer needle trajectory, and here also for steep angle. So this is what you can practice. You can assume, that's what I was saying, any target to be hit. So now like see, I have to come at the lower end of the vessel. This is our vessel. Okay, so my angle will be approximately, most of the time it is 45. Okay, so that's my needle. Okay, that's my needle coming and like little bit upward. Yes, so seeing the tip and just below the artery, like in saphenous, or when you want to separate the membrane, then slightly over the artery, slightly over the artery. So these are the things you can practice, and I sincerely hope you will find it helpful. Thank you very much for your time.